The United States has long been a beacon of hope for vulnerable communities worldwide, providing essential aid to combat disease and promote development. However, recent drastic cuts to U.S. foreign aid have sent shockwaves across the globe, particularly in Africa, where millions depend on this lifeline. The consequences are dire, jeopardizing decades of progress in health and plunging the continent into a preventable crisis. The World Health Organization warns that these cuts could have catastrophic consequences, potentially leading to an additional 500,000 deaths due to restricted access to treatment and vaccinations. The time for decisive action is now, as the world watches with bated breath, hoping for a reversal of this tragic course. Across the African continent, the human cost of U.S. aid cuts is becoming increasingly apparent. In Kenya, clinics that once provided life-saving treatment for HIV/AIDS are now struggling to keep their doors open, leaving patients in desperate need of medication. In Sudan, already grappling with the triple threat of cholera, malaria, and measles, the health system is on the verge of collapse as funding for essential programs dries up. The stories emerging from these countries paint a harrowing picture of suffering and despair. Parents are forced to make agonizing choices between feeding their families and seeking medical care for sick children. Healthcare workers are stretched thin, working tirelessly with limited supplies and dwindling morale. The situation is nothing short of a humanitarian catastrophe, and the world cannot afford to stand idly by as lives are needlessly lost. The ripple effects of these cuts extend far beyond the immediate impact on healthcare. With reduced funding for education and economic development programs, the cycle of poverty is perpetuated, trapping generations in a web of despair. The loss of hope is palpable, as communities that were once making strides towards a brighter future are now grappling with the devastating consequences of this policy reversal. The international community must recognize that investing in global health is not merely an act of charity, but a strategic imperative. By working together to strengthen health systems, combat infectious diseases, and improve access to essential healthcare, we can create a healthier, safer, and more prosperous world for all. The recent Ebola outbreak in Uganda serves as a stark warning of the heightened vulnerability of African nations in the face of U.S. aid cuts. The outbreak, caused by the Sudan virus strain, has already claimed lives and exposed the fragility of healthcare systems struggling to cope with limited resources. The lack of an FDA-approved treatment for the Sudan virus, coupled with its historically high fatality rate, makes this outbreak particularly concerning. The situation is further compounded by the suspension of USAID funding, which has crippled the response effort and left health organizations grappling with mounting debt. Section 4, HIV/AIDS, a resurging threat amidst funding cuts. The fight against HIV/AIDS, once a beacon of hope and progress, is now facing significant setbacks due to U.S. aid cuts. The President's Emergency Plan for AIDS Relief, or PEPFAR, a program credited with saving over 25 million lives, primarily in Africa, is grappling with severe disruptions to its operations. South Africa, home to the highest number of people living with HIV globally, is particularly vulnerable to these funding cuts. PEPFAR provides nearly 20% of the country's $2.3 billion annual budget for HIV/AIDS programs. With clinics forced to close and patients struggling to access life-saving antiretroviral medication, there is a real risk of the epidemic spiraling out of control. Even short interruptions in antiretroviral treatment can have devastating consequences for people living with HIV, allowing the virus to rebound and potentially leading to drug resistance. The progress made in reducing new infections and AIDS-related deaths is now in jeopardy, as funding cuts threaten to unravel years of hard-won gains. Section 5, a call to action restoring hope and saving lives. The United States has a moral imperative to reverse course and restore funding for global health initiatives. The lives of millions of people in Africa and around the world depend on it. We must not allow political expediency to trump our shared humanity. I urge readers to contact their elected officials and demand increased funding for global health programs. Support organizations working on the front lines of this crisis. Educate yourselves and others about the devastating impact of these aid cuts. Together we can raise our voices and demand a more just and compassionate world for all. The time for complacency is over. The time for action is now. Let us rise to meet this challenge with the urgency and compassion it deserves before it's too late.